Contamination in the hospitals. A few places contamination could be spread in the hospitals. The doorknobs are touched by people as they enter the hospital and would be the first to spread germs. The air in the waiting rooms are contaminated with germs. Paperwork that is to be filled out and then handed back to the staff is then contaminated, as well as a pen being used by every patient. Sitting next to another sick patient while in the waiting room. The cloth curtains that separate the patients in the treatment rooms are coughed on and also touched by sick patients. The floors are very contaminated and can cause a crawling baby to easily catch an illness, as well as many germs. Examples of how contamination can impact patients in the emergency room. Number 1. A parent's worst fear when their child is sick and needs to be seen at the emergency room is the other illnesses the child can catch while visiting. For example, say the child has croup and can hardly breathe. That child could sit next to a patient with the flu and not even know it, and then the parent or the child can easily be contaminated. Number 2, a patient being seen at the emergency room for a broken bone or for a fishing hook stuck in the patient's finger has to also worry about getting sick in the process of entering. The bodily injured patient can catch an illness by touching the same pen used by the patient with an illness or sitting in the same chair once used by the contaminated patient. Number 3, contamination not only affects the patients, but it also affects the staff as well. The staff has to check the patient's blood pressure, the patient's weight, and the patient's breathing. Wearing masks and gloves would help the staff tremendously. The importance of contamination and ways to avoid it. Contamination is contagious and filled with germs. Germs are everywhere and can be spread easily. Contaminated areas can be sanitized by employees, yet contaminated a few seconds later just by the presence of a person with an illness. Hospitals are a top place for contamination to be found. While the hospital tries to maintain a clean environment, there are still germs and contamination that circulate through the hospital. It is very important for people to know the precautions that can be taken to help from catching an illness in a contaminated area, such as the hospital. For example, wash your hands before entering. Wear protective gloves against germs. Wear a mask while entering the hospital. Notice your environment and try to sit far away or next to someone that is not sick if possible. How contamination relates to my career choice. I am going into nursing, so taking precautions against contamination will be an everyday task for me. I will be working in areas surrounded with patients with many illnesses and many germs that are being spread. As I research ways to help contamination that can help myself from getting contaminated, along with others around me, with giving them the information that I have researched and that I have learned. I have a passion for helping others. Therefore, being hands-on is a must. Not only is nursing a passion, but I am helping others as well. As I see people out that are struggling with illnesses and that are struggling with injuries, I cannot help but to ask them what all I can do for them. Contamination is a big deal and can harm many in its path. I want to change that if I can while helping others in the process.